All right, thanks so much, Darcy. Well, the past few months have brought news of several high-profile celebrities that have tragically taken their own lives, and recent studies indicate that suicide is the second leading cause of death for Nevada youth ages 15 to 24. That is alarming. September is National Suicide Prevention Awareness Month, reminding us of the importance of talking about the topic and educating ourselves on warning signs and how to help those that we care about, because sometimes we hear about it a lot. Dr. Aaron Honk is from Touro University, Nevada, joining us with some more information about this, and it does seem to be coming up more and more because we're hearing it in the news. Suicide usually isn't in the news unless it's a high-profile person or it's disrupting an incident or, you know, closure. So we're hearing about it more. Do you think that that's making it happen more?
Well, not necessarily. I think that it's probably, like you said, in the news because it's more high-profile cases. I think that it probably does happen a little bit more in the younger crowd because there's more stressors or more changes in their life, like bullying and things like that. So.
Yeah. Have we seen a rise, or is that a statistic that when I was saying Southern Nevada, 15 to 24, we're seeing that as the second leading cause of death? Is that normal, or is that up?
It seems to be pretty consistent over the last few years, but we're always gathering research.
Do you think technology has something to do with it? Kids be able to talk to each other on their phones and maybe send each other messages anonymously, which is kind of a tactic for bullying?
I think it absolutely could be. I mean, like you said, there's more accessibility to bully and really send messages and communicate with each other in all of these different ways.
Talk to me a little bit about the warning signs. I know sometimes, even I've been in situations where people say they want to. Is this something that we should alert us, or is it something if they're not saying it, but we notice certain signs, that's when we should really tell someone? When do we tell someone?
Well, I mean, I try to err on the conservative side. We use an acronym. It's called Is Path Warm. You'll see this publicized within the different suicide prevention organizations. Really, it looks at, has anyone really talked about suicide or self-harming, so ideation? Has there been a presence of substance abuse or an abrupt change or increase in substance abuse? Does somebody feel hopeless or helpless? Do they have positive things happening in their life, or do they feel like they're trapped or they can't get out of that part of their life that they're in at the moment? Has there been fluctuating moods or mood changes, anxiety, depression, labile moods, anything that's not normal for that person? That would be a high risk factor. Another risk factor that's really concerning is if someone starts giving away their personal belongings. That's something that you should notice and note with that person. You know, why are you giving away your personal possessions? You know, what's going on? Is that person future oriented? Do they have appointments, or are they attending school? Are they consistently going to work? Have they lost a job? Have they lost family support? All of these different things can be major risks for somebody thinking about or having those ideations for harming themselves or others as well.
Really good information. Unfortunately, we don't have a lot of time to talk about it. Where can we go for more information, and who do we alert? Is there a number or a hotline? Or?
You can alert a lot of different people. If it's imminent risk, you feel like somebody's hurting themselves, they're cutting, they're burning, 911.
Okay.
Police will come out and assess. You can take them to an ER. There are places called psychiatric urgent cares as well. I think there's one in Reno. But you can go to an ER. You can call counseling services, school counselors, and places like that. So.
Thanks so much for joining us. Some obviously important information for everyone at home. Stay with us. We're back after this.